Now, within the section of systematic bacteriology in the course of medical bacteriology, advanced medical bacteriology, dear my students, I will start today with the pathogenic cocci. When we talk on the pathogenic cocci, I will talk with the Staphylococci, Streptococci, Neisseria gonorrhea, Neisseria meningitidis. All of these lies within the pathogenic cocci. In this video lecture, I will present the most medically important gram-positive pathogenic cocci, Staphylococci, and Streptococci. The Staphylococci who studied this bacterium previously, Staphylococci are included in the Vermicutis bacteria within the family of Mycococcaceae and the genus Staphylococcus, which classified or involved three important species: Aureus, Epidermidis, and Saprophyticus. According to the contemporary classification, Staphylococci are subdivided into more than 30 species. Among them, Staphylococcus aureus, Staph epidermidis, and Staph saprophyticus, in addition to Staph hemolyticus, capitis, hominis, werneri, and xylosus, and blah blah. Staphylococci are spherical in shape, 0.8 to 1 micrometer in diameter, and form irregular clusters resembling bunches of grapes. In smears from culture and pus, the organism occur in short chain, as you show here. It may appear as pairs or single cocci. A large spherical L form or very small G form and even filterable form may be seen in culture which have been subjected to various physical, chemical, and biological antibiotics, for example, factors. L form, as you know, L form when the Staphylococci exposed to beta-lactam antibiotic like penicillin, piperacillin, and etc., it will lose the cell wall. Thus, it's called L form bacteria. While G form is representative for very, very small bacteria, very small strains of Staphylococcus aureus, and also a filterable form will be formed even after exposure to physical or chemical factors. This image represents the grape-like clusters of Staphylococcus aureus under electron microscopy. This slide represents the Staphylococci after staining the slide with gram stain. It appears as gram-positive cocci arranged in single diplococci or grape-like clusters, as you show typically in this slide. It is non-spore forming and it is not flagellated and not spore forming. Regarding to the cultural characteristic to the cultivation of Staphylococcus aureus, Staphylococci are facultative anaerobes. What does it mean? It means it can grow in the presence or absence of oxygen. They grow well on ordinary nutrient media with a pH of 7.2 to 7.4 at a temperature of 25 centigrade, but do not grow at temperature below 10 and above 45 centigrade. At room temperature with adequate aeration and subdued light, the organism produces golden, white, lemon yellow, and other pigment known as lipochromic. إذن البيجمنتد ستافيلوكوكس شو نسميها؟ نقول عليها lipochromes or lipochromic microorganism. These pigments do not dissolve in water but are soluble in ether, benzene, acetone, chloroform, and alcohol. Here, my student, I need to concentrate on the classification of Staphylococcus aureus according to two main topics. According to the pathogenicity, I can classify the Staphylococcus to Staphylococcus aureus, which is pathogenic for human, Staphylococcus epidermidis, which is which is pathogenic under certain circumstances in immunocompromised patients, and indwelling it associated with indwelling medical devices like prosthetic devices, double J stent in catheter, catheter biofilm catheter, Foley catheter in urine, and any indwelling medical devices, so either animate or inanimate objects. Also, I may refer to the stent, double J to stent, to the shunting, to the external and internal fixation with steel, especially in the orthopedic purposes in the surgery after or during surgery. And according to the that is according to the pathogenicity, according to the pigmentation, I mean according to the color for colonies on plates, we can classify Staphylococcus into Staphylococcus aureus, which characterized by the formation of golden colonies on the nutrient agar, and Staphylococcus albus, within two brackets epidermidis, when I talk on the pathogenicity. Albus, in Latin language, it refers to albino, it means whitish. Staphylococcus albus, okay? And Staphylococcus cereus, it refers to Saprophyticus. I think I here need to concentrate on Staphylococcus saprophyticus and or cereus. Staphylococcus saprophyticus, it is saprophytic bacteria, but can cause disease in sexually active women. Okay, and it is called also cereus because it can produce lemony color of colonies on the media. I refer to the cultural characteristic of Staphylococcus aureus. On meat pepton agar, Staphylococci produce well-defined colonies with smooth edges measuring from 1 to 205 mm in diameter. Growth of Staphylococci in meat pepton broth produces diffuse opacity throughout the medium and subsequently participate. In some cases where there is sufficient aeration, التهوية الجيدة, the organism may form pellicle on the surface of the earth, as well as formation of pellicle in tubercle CSF, in CSF of patients suffering from Mycobacterium tuberculosis. Also, pellicle may be formed on the surface of CSF. Why? Because the sharing characters between Mycobacterium tuberculosis and Staph, both of them can grow under aerobic condition. Okay, Staphylococci grow well on potatoes and coagulated serum. After 24 to 48 hours of incubation, there is usually abundant growth along the inoculation step and liquefaction of gelatin media. On the 4th or 5th day, the gelatin media resembles a funnel filled with the fluid. On a blood agar, pathogenic Staphylococci cause hemolysis of the erythrocytes. And what's the type of hemolysis here? The type is the beta hemolysis, which is mean complete hemolysis of RBCs. Now, I need to explain very important topic. What is the physiological basis of hemolysis of Staphylococci on the blood agar, for example? The fact referred to, Staphylococci produce hemolysin enzyme. Hemolysin enzyme will bind to the ergosterol binding unit on the surface of erythrocyte. At each binding site for Staphylococci to the ergosterol binding site, it leaves the pores ثقوب in the site of binding, at the site of binding. Thus, when the hemolysin enzyme will bind to the all ergosterol binding unit on the Staph, it leaves pores on all sides. Thus, it will cause complete rupture for the Staphylococci, for the RBC, and cause whole rupture and complete rupture of the RBCs, causing complete hemolysis and form clear zones around the colonies. This represented by beta hemolytic or complete hemolytic of Staphylococcus aureus on the blood agar when it distracts the earth. Right. In this slide, here we show the complete hemolysis around the colonies, as you show here. And in this plate, we show the yellowish or golden color of Staphylococcus aureus on the plate. And this represents the Staphylococci on the blood. Regarding to the antigenic structure of Escherichia coli, there are two types of polysaccharide, and A and B. Also, antigen C is found within the antigenic structure of Staphylococci. Regarding to the polysaccharide A and B, what is the difference between them? Polysaccharide A was extracted from pathogenic strain, while polysaccharide B was extracted from a virulent, non-pathogenic strain. That's the main and first difference. Second, the chemical structure will differ between A and B. Chemical structure will be differ from A to B. And third, the serological reaction will differ from A to B. Okay? A can isolate from patient septicemia, bronchiolitis, stomatitis, and also conjunctivitis. While polysaccharide B, as I mentioned, it is extracted from virulent or non-pathogenic strains, and both of them differ not only in their serological reaction but also in their chemical structure. Thus, I mentioned the three differential points between A and B. With regard to the antigen C, I concentrate here the antigen C was or has recently isolated, it containing a specific polysaccharide, and this now the function of this antigen is not well known. Now I will talk on the virulence factors of Staphylococcus aureus. Staphylococci express many cell surface associated and extracellular proteins that are potential virulence factors. After a few seconds, I will nominate the virulence factor on the whole human body. For the majority of disease caused by this organism, pathogenesis is multifactorial. Thus, it is difficult to determine precisely the role of any given factor. This also reflects the inadequacies of many animal model disease. These are the major virulence factors which are found in human body, and we will discuss later on the disease on the human body. These are the virulence factors. I will start from protein A, microcapsule, and cell wall. With regard to the microcapsule in Staphylococcus aureus, we have a capsule, but a capsule is of type microcapsule. It means not a true capsule. Not a true capsule because it is non-antigenic. No antibodies formed against it. Thus, it is called microcapsule. While the infacins refers to the molecules which can invade deeply in the tissue of human suffering from Staphylococcus aureus infection. Infacins include hyaluronidase, staphylysins, leukocidine, leukotoxin, coagulase, staphylokinase, adhesin cell-bodied protein. All of these are infacins. About adhesions, like adhesins, the molecules which are responsible for adhesion. There's a difference between adhesins and adhesion. Adhesion is the whole process. Adhesion, attachment, adherence, all of them are correct. Adhesins, the molecules which is responsible for adhesion. Also, I have here fibronectin damaged tissue. Also, in addition to all of these virulence factors, there are many important toxins which cause damaging to the membrane of the cells. These toxins are toxic shock syndrome toxin, exovolative toxin, and staphylococcal enterotoxins. Okay. Regarding to toxic shock syndrome toxin, it causes toxic shock syndrome. Exovolative toxin is called exfoliation, while staphylococcal enterotoxin A to G, it causes emesis. All of these toxins cause cell membrane damage. These are the valence factors of Staphylococcus aureus. I will gradually point it on the most important and valence factor. Protein A. Protein A is a surface protein of Staphylococcus aureus, which binds to immunoglobulin G molecule by the Fc region, and in serum bacteria will bind to the IgG molecule the wrong way around by this non-immune mechanism. In principle, this will disrupt opsonization. طبعا opsonization هي أكيد اللي دارس منها طبعا. الopsonization هو البروسيس اللي هو pre requested to phagocytosis. Opsonization when I need to visualize the antigen, I will render the opsonin on the surface of antigen to show it by antibodies, and followed by our phagocytic cells. Follow that, it will go to the phagocytosis. Okay. Indeed, mutants of Staphylococcus aureus lactic protein are more efficiently phagocytosed in vitro. and اذا اللي هو عنده بروتين اي هو يكون حقيقه اصعب انه ينشا بالفاجوسيتوزيس، في حين اللي يكون lacking بروتين اي are more efficiently phagocytosed in vitro. And studies with mutants in infection models suggest the protein A enhances leukocidine. Leukocidine, the other virulence factor which can produce from Staphylococcus aureus. From its name, it lies the polymolecular leukocyte. Staphylococcus aureus can express a toxin that specifically acts on polymolecular leukocytes. Phagocytosis is an important defense against staphylococcal infection, so leukocidine should be a virulence factor. Okay. Now, I will talk with the most important toxins which cause damage to the membrane. I will talk on the alpha, beta, gamma, delta, and toxic shock syndrome toxin. I'll talk primarily on the alpha toxin, which is the best characterized and the most potent membrane damage toxin of Staphylococcus aureus. The susceptible cells have a specific receptor for alpha toxin, which allow low concentration of toxin to bind, causing what? Small pores through which monovalent cation can pass. Okay, but at higher concentration, what does occur? At higher concentration, these at low concentration. At higher concentration, the toxin reacts non-specifically with the membrane lipids, causing large pores through which divalent cation and small molecules can pass. However, it's doubtful if this is relevant under normal physiological conditions. Thus, in human, platelets, monocytes are particularly sensitive to alpha toxin. Thus, when I distract platelet and monocytes, here I will be knowledgeable what is the sensitivity of these elements against alpha toxin. The other type is the beta toxin. What does mean by beta toxin? Beta toxin is a sphingomyelinase which damage membrane rich in this lipid, in sphingomyelinase or lipids. That it is sphingomyelinase which damages the membrane, the sphingomyelic acid, the sphingomyelic. The classical test for beta toxin is the lysis of sheep erythrocyte. Thus, the majority of human isolate of Staph aureus do not express beta toxin. Here, a lysogenic bacteriophage is inserted into the gene that encodes the toxin. This phenomenon, this phenomenon is called negative phage conversion. Negative phage conversion. Some of the phages that inactivate the beta toxin may carry the determinant for an enterotoxin and staphylokinase. Now, alpha, beta, delta toxin. Delta toxin is very small peptide toxin produced by most strains of Staphylococcus aureus. It's also produced by Staph epidermidis and Staph lugiodensis. The role of delta toxin in disease is unknown. Okay, gamma toxin and glycosidine. The fourth type of membrane damaging toxin, gamma and glycosidine. The gamma toxin and the glycosidine are two component protein toxins that damage membranes of susceptible cells, as I mentioned previously. The proteins are expressed separately but act together to damage membranes. There is no evidence that they form multimer prior to insertion into membrane. The delta gamma cell toxin expresses three proteins, B and C components, which form leukotoxin with poor hemolytic activity, whereas the A and B component are hemolytic and weakly leukotoxic. إذا شفنا الكونترافيرسي الموجود ما بين B and C components، واللي هو يعمل لي poor hemolytic activity، في يعني hemolytic activity يعود لل A and B component. Now I will talk on the super antigens, which is also classified in the tissue damaging toxin. Super antigen, enterotoxin and toxic shock syndrome toxin. Both of them, not only toxic shock syndrome toxin, as some of lecturers says, it's called as a super antigen. Also, enterotoxin, it may also described as a super antigen. Now, what does it mean by super antigen? Before I talking on this paragraph, what does it mean by super antigen? The super antigen, it differs from normal antigen in that it is not need antigen presentation. It will bind directly through the antigen grooves to the major histocompatibility complex. It must need antigen presentation, as this occur in the ordinary or normal antigen by presenting the antigen presenting cells, present the antigen through phagocytic cells and dendritic cells and other antigen presenting cells. Super antigen not need antigen presentation. Okay. These toxins, Staphylococcus, are two types produced by Staphylococcus aureus with super antigen activity. Enterotoxin, of which there are 6 serotypes, A, B, C, D, E, and G. Disregard with enterotoxin, except F, A, B, C, D, E, and G. And toxic shock syndrome toxin 1 and 2. Toxic shock syndrome toxin 1 is produced largely by Staph aureus. Enterotoxin cause diarrhea and vomiting when ingested and responsible for staphylococcal food poisoning. I would like to inform you the food poisoning could caused by Staphylococcus aureus will remain 24 hours in human body. Thus, the diarrhea may extend for just 24-hour urine. 24 hours. When expressed systematically, enterotoxins can cause toxic shock syndrome toxin. Indeed, enterotoxin B and C cause 50% of non-menstrual toxic shock syndrome. Yes. Now I'm talking with the important toxin which cause splitting of epidermis. It is called exfoliative toxin. This toxin causes the scalded skin syndrome in neonates with widespread blistering and loss of the epidermis and have protease activity. It is not clear how the latter causes epidermal splitting. It's possible that the toxin targets a very specific protein which is involved in maintaining the integrity of the epidermis. Other extracellular proteins include coagulase. Now, what is the importance of coagulase clinically before I will going deep on the coagulase? As you know, the Staphylococcus cause staphylococcal abscess in the human body. In the staphylococcal abscess, it will be in abscess. The staphylococcus will be hidden inside the abscess. Why? Because it produces coagulase, which convert fibrinogen into the fibrin, and the fibrin layer will protect the staphylococci inside the abscess. Okay. And then coagulase is an extracellular protein which binds to the prothrombin in the host to form a complex called staphylothrombin. The protease activity of characteristic of thrombin is activated in the complex, resulting in conversion, تحول الفibrinogene to fibrin. And as I know, this is the basis of the tube coagulase test, in which a clot form in plasma after incubation with the Staphylococcus aureus. Both culture supernatant. الكوagulase طبعا هو المين and traditional marker for identifying Staph aureus from other species of the genus Staphylococci, because Staphylococcus epidermidis and Saprophyticus are negative to coagulase, while coagulase will do with the Staphylococcus aureus. Very important protein or enzymes, staphylokinase. Many strains of Staph aureus express a plasminogen activator called staphylokinase. Dear students, staphylokinase is very important for in medical situation. Why? I will talk to this fact in the following rows. The genetic determinant is associated with pathogenic bacteriophage, a complex form between staphylokinase and plasminogen. Activate plasma like proteolytic activity, which causes dissolution of fibrin clots. Thus, it is used here. It is used in the intensive care unit بالوحدات الإنعاش in the hospitals. Why? Because it's used to treat coronary thrombosis, because it can dissolve the clots form in the coronary thrombosis. Then it is used in medicine to treat patients suffering from coronary thrombosis, which suffering from clots. As with coagulase, there is no evidence that Staphylococcus is a virulence factor, although it seems reasonable to imagine the localized fibrinolysis metates in the bacterial sprinig. هنا شنو بدنا نحل بهذه العبارة؟ هنا اكو عندنا virulence factor أنا أقدر أسميها primary or main virulence factors اللي هي which can act to increase the pathogenicity of the microorganism. هنا الcoagulase هذه الانزيمز coagulase والstaphylokinase, it may act secondarily by coagulase by formation of the fibrin, which aids in the protecting the fibrin the staph from the other defense mechanism by formation of fibrin around it. And staphylokinase, which is used for what? For dissolving the clots. Thus, the role of both of coagulase and staphylokinase is secondary, and it is considered very important for staphylococcal infections. Other enzymes can be produced from Staphylococcus aureus, like what? Like protease, which destruct protein, lipase, which destruct lipid, and DNase, which destructs deoxyribonucleic acid and a fatty acid modifying enzymes in the semi-FAMI. Okay? Well, FAMI enzyme may be important in abscesses, where it could modify antibacterial lipid and block bacterial survival. The thermostable DNase is an important diagnostic test for identification of Staphylococcus. Okay. It may cause infection also if the skin or mucous membrane, as I mentioned, are broken or damaged. Staphylococci are responsible for a number of local lesions in human. For example, hidradenitis, abscess, bronchitia, blepharitis, الفرنكل carbuncle البريوستيتس osteomyelitis folliculitis psychosis dermatitis eczema conjunctivitis peritonitis meningitis appendicitis and cholecystitis. All of these are very, very important lesions, infected lesion in human. Also, Staphylococcus, most pathogenic species which can cause abscess, boils, carbuncle, acne, impetigo, and less commonly pneumonia, osteomyelitis, endocarditis, cystitis, pyelonephritis, and food poisoning. There are predisposing factors in the patients which can facilitate the occurrence of staphylococcal infection, like diabetes mellitus, which cause immune suppression for the patient to be immunocompromised and easily infected by any disease, not only staphylococcal infection. Avitaminosis, elementary dystrophy, excess perspiration, minor occupational skin abrasions, as well as skin irritation caused by chemical substances, these are some examples of conditions conducive to the formation of biogenic lesion of the skin and furunculosis. I would like to say that when I say biogenic infections, what does mean by biogenic infections? Biogenic infections refers to the infections caused by pus-producing microorganism. Okay, of these microorganisms which produce pus are Staphylococci, Streptococci, Streptococcus pneumonia, TB, and blah blah blah. All of these can produce pus. Thus, it's called biogenic. Okay. Also, all of these diseases which are mentioned previously are considered as a primary infection, the first cause of infection. But in some cases, the viral infection will be started in the body, and thus it's called the viral will be primary, and the bacterial bacteria give rise to be secondary infection in individuals suffering from smallpox, influenza. First, when the patient suffers from influenza, the advice from the doctor is to take antibiotics or certain antimicrobial agents. Why? To prevent the secondary bacterial infection after primary infection caused by virus. In addition to wounds as well as post-operative separations. Staphylococcal sepsis and staphylococcal pneumonia in children are particularly severe diseases. Ingestion of foodstuffs, cheese, curds, milk, wheat cakes, and pastry, ice cream contaminated with pathogenic staphylococci may result also in food poisoning. It is well known and recognized that staphylococci play an essential part in mixed infections and are found together with streptococcal in cases of wound infection, diphtheria, tuberculosis, actinomycosis, and angina. That means it is maybe one of the two in the mixed infection caused by poison. Now, when I talk on the identification of gram-positive cocci, especially staphylococci, I will take a second for a review to what I said previously. It contains both pathogenic and pathogenic organisms. Do not produce endospores but are resistant to drying, desiccation. Found routinely on the surface of the skin. 3 major species, Aureus, epidermidis, and saprophytical species are found for the genus Staphylococci. And these 3 species can be distinguished from each other by various biochemical tests. And in this lab, in this virtual lab, which I talk after that, I will take observations. In this table, the main species of Staphylococci will differ each from other by these characters. In regarding to coagulase, positive, negative, respectively, Aureus, epidermidis, and saprophyticus. Phosphatase, positive, negative. Reductase, positive, negative. In protein A, superficial antigen, positive, negative. In the mannitol fermentation, positive for Staphylococcus aureus. Thus, when we talk on the mannitol short agar after 5 seconds, Staphylococcus aureus will ferment mannitol to form acid and reduce the pH to be below than 7, acidic environment. Negative for epidermidis and positive for saprophyticus, but in the difference in mannitol shock agar, here it resists high salt, it must resist high salt. Okay? 3 halos, positive, negative, production of alpha toxin, positive, negative, and resistance to novobiacin, sensitive, and resistance to saprophyticus. First, the novobiacin here make us a diagnostic disc which differentiate Staph saprophyticus, which is resistance to novobiacin, in comparison to Staph aureus and epidermidis, which are sensitive to biocin. The identification of organism is based on cellular, cultural, and biochemical characteristics, and all staphylococcal species are gram-positive cocci. On nutrient, they tend to be white or cream, circular, entire, convex colonies. These are the macroscopical, not micro, macroscopical or cultural characteristic of Staphylococcus aureus on nutrient agar. On sheep-led agar, Staph aureus may exhibit hemolysis. What is the type of hemolysis here? It is beta hemolysis around clear zones around the colonies. Tested to be formed catalase, oxidase, catalase, coagulase, and growth and fermentation of mannitol salt agar in addition to susceptibility to novobiacin. Here, catalase, as you would show, this represent the pigmentation of yellow or golden colonies, a typical characteristic for colonies of Staphylococcus aureus, which is characterized by formation of golden or yellowish colonies on the catalase test. In catalase test, the catalase enzyme will destruct the hydrogen peroxide, H2O2, which is found in pharmacies at 3%, while the correct concentration to be used in this test is 6%. Catalase test will destruct H2O2 plus H2O plus O2, and this bubbles is referred to the oxygen gas, while this represents negative results, no bubbles, no gas formed, while here oxygen gas will be formed. Okay, that is regarding catalase test. Regarding to the coagulase test, a coagulase in this tube coagulase test, there are 2 methods for coagulase test. First one is the slide coagulase test, and the second is the tube coagulase test. And this tube coagulase test, this represents negative results, while this tube form positive results. And as you know, the principle of coagulase is the formation of fibrin around the fibrin, and the fibrin will protect the bacterial cell from the immune system, and it's make as a coating layer, as I mentioned, the reddish color from the yellowish, from the reddish to the yellowish color due to formation of fermentation of menthol, and acidic pH will be formed in the media in addition to the tolerance to the high salt. And we show after one slide the picture of mannitol salt agar after going of Staphylococcus aureus on it. Regarding the antibiotic susceptibility test, here antibiotic susceptibility is used for 2 purposes. One of them is the use as the diagnostic disc, for example, novobiacin, which differentiate between Staphylococcus saprophyticus and other 2 species, Aureus and epidermidis. As you know, as you taught, Staphylococcus saprophyticus will be resistant to novobiacin, while novobiacin will act on the both of Staphylococcus aureus and Staphylococcus epidermidis. In addition to that, antibiotic susceptibility may be due by either distribution method, agar dilution method, broad dilution method, on to detect which drug of choice for the treatment of staphylococcal infection. Okay. And as you show here, the sensitive antibiotic, the symbol is the S, while the resistance is symbol is the R. Okay. And the diameter will be precisely, as you know, the diameter will include all the diameter of the disc. In catalase test, as you show here, what are the interpretations of results? In catalase, the formation of bubbles, which is indicating the positive test for the and formation of oxygen gas. Coagulase, formation of latex agglutination. Agglutination is positive on the slide, while if I use tube coagulase test, the formation of fibrin from the conversion of fibrinogen into fibrin will be formed in the tube of coagulase test, and thus this represents the positivity of coagulase test. Okay. Now, this represents the positive of coagulase test, formation of bubbles due to gas oxygen gas, and this represents the positive agglutination test when we use slide agglutination test. While I showed in the previously the result of tube coagulase. Mannitol salt agar, as we show here, the media in the red color, and after this represents the control, the negative result, the color of media. After the fermentation of mannitol and toleration of Staphylococcus aureus to the NaCl to the high salt, the pinkish color will change to the yellowish color, which will indicate the positive results. The mannitol salt agar may be appear here in the tubes or may be formed on the plates. Okay. Regarding to the neovirus susceptibility test, as you show here, this represents Staphylococcus saprophyticus. Why? Because it resists novobiocin. Thus, all the diameter is about 6 millimeter, while here 6 millimeter is the diameter for the disc. While here, Staphylococcus aureus or epidermidis may be sensitive to novobiocin, and thus it appears here sensitive. Okay, the zone of inhibition may be more than 17 millimeter, while in the resistance, if the zone is greater than, it is called a zone of growth inhibition. Here, a zone of growth inhibition is 17 millimeter or less in diameter, indicate resistance, while sensitive is more than, if the zone diameter is more than 11 millimeter, the organism susceptible to novobiocin. Okay, here we are measure the zones of growth. Here measure the zone of sensitivity, and in this manner we calculated by taking the ruler on the disc, and the diameter of the disc will be included in the Staphylococcus aureus. After finishing the section part of Staphylococcus aureus, I would like to give you a welcoming and for your patience with me and good listening for this lecture. Okay, you are welcome. Secondly, we will go now to the Streptococci, the second and most important species of gram-positive cocci, which can cause several and most severe disease of human bodies. Regarding to the morphology of Staphylococcus aureus, most streptococci are circle in shape, 0.6 to 1 micrometer in diameter, and form chains. The chains may be long or short chains. For your information, the long chains may always be associated with the pathogenic streptococci, while short chains is always may be associated with the non-pathogenic strains of streptococci. They are non-motile, although motile forms are encountered, do not form spores, and are gram-positive. Some strains are capsulated in, like Streptococcus pneumonia. In smears from culture grown on solid media, the streptococci are usually present in pairs or in short chains, while in smears from both culture, they form long chain or cluster. Now, regarding the cultural characteristic of Staphylococcus aureus, streptococci as well as Staphylococci are facultative aerobic, and there are also anaerobic species like anaerobic streptococci, which can cause abscess in human and closed cavity infections. The optimal temperature for growth is the 37, and no growth occurs beyond the limits of 20 to 40, and the typical the 32nd. For enterococci, the limits are 10 to 45 centigrade. The organism show poor growth on the ordinary meat peptone agar and go well on sugar, blood, serum, and acetic agar and broth. When the pH of the media is 7.2 to 7.6, and on solid media they produce small colonies, translucent, grayish-white, and granular colonies with poorly defined margins. While on sugar, broth media, the growth is formed of fine granular precipitates, on the walls and at the bottom of the tubes, and only rarely does the broth become turbid. Thus, when we're looking to the broth in the case of blood culture, we can suspect the type of microorganism according to the appearance of the solutions. If it is from cotton balls, if it precipitate, and blah blah blah, and can suspect what is the type of microorganism here. Some streptococcal chains cause hemolysis in the blood agar. Here we can classify the streptococci according to the hemolysis on blood agar in 3 species: Streptococcus biogenes, Streptococcus viridans or viridans streptococci as a group, or Streptococcus fecalis. And according to the hemolysis, I can differentiate the hemolysis to alpha, beta, gamma. These three types of hemolysis may seen or may occur in streptococcal infection. For example, a complete hemolysis will occur in group A streptococci, اللي هو Streptococcus biogenes, group beta alpha hemolytic streptococci, which is caused by virulent streptococci, as a greenish discoloration around colonies, and no hemolysis will form by gamma hemolytic like Streptococcus fecalis. This schematic representation clarify the identification of facultative gram-positive cocci, اللي هي Streptococcus and Enterococcus. Hemolysis on blood agar alpha, beta, gamma. alpha بالسولوبتين نسوي الابتوتشين ديسك، لان اذا الابتوتشين سنسيتيف راح تكون ستريبتوكوكس نيمونيا، واذا الابتوتشين نيجاتيف راح يكون فيريدنس ستريبتوكوكاي. طبعا يا اخوان ستريبتوكوكس فيريدنس هذه اصبحت الاولد نيم. يا طلبنا الاوثنتيك or modern name is the viridans streptococci as a group, which include Streptococcus mitis, Streptococcus mutans, Streptococcus sanguis, and blah blah blah. اوبتوتشين بوزيتيف نيمونيا، اوبتوتشين نيجاتيف فيريدنس. اوبتوتشين بعدين نسوي الباستراسين if positive it is biogenes, if negative non group A. طبعا هذه منه البيتا. اذا الالفا ورا من يكون اذا هي الفا هيموليسيس ما نقدر نلزم هل هي نيموكوكاي او فيريدنس ستريبتوكوكاي، لكن بالاوبتوتشين راح نميزه اذا كان بوزيتيف نيموكوكاي واذا كان نيجاتيف راح يكون فيريدنس ستريبتوكوكاي. البيتا هيموليسيس راح نعمل له شنو؟ نعمل له الباستراسين، اذا كان بوزيتيف هذا ياكد انه هو الجروب اي، طبعا الجروب اي according to the Landsfield الجروب اللي راح نتكلم عنه، والستافيلوكوكس بايوجينز، واذا كان نيجاتيف فهو نون جروب اي Landsfield classification. بالنسبه للنوع الثالث من الهيموليسيس اللي هو الجاما، مثل قلنا الستافيلوكوكس فيكاليس، راح نسوي البايل اسكولين اللي هو الهاي سولت، اذا كان بوزيتيف فهذا هو الانتيروكوكس سبيشيز، يعني هي tolerate high salt. Which is what are the examples for each one? For alpha Staphylococcus pneumonia، واذا كان Staphylococcus pneumonia طبعا نوعين، اذا كانت uptouching positive Staphylococcus pneumonia, negative virulent Staphylococci. Synquence mutants, mitis, beta Staphylococcus biogenes, gamma Staphylococcus. Okay, this typical presentation of beta hemolysis on blood agar. Okay, yeah, the alpha hemolysis, green discoloration around the colonies as you show here, and gamma hemolysis, non-hemolysis or no hemolysis, non-hemolytic on blood agar. Okay. Fermentative properties, the Staphylococci are non-proteolytic, do not liquefy gelatin, and do not reduce nitrates to nitrates. They coagulate milk, dissolve fibrin, ferment glucose, maltose, lactose, saccharose, mannitol, not always constantly, and break down salicine and trihalose with acidic formation. Regarding to the toxin production, there are several toxins can be produced from streptococcal species. Hemolysin, leucocidine, lethal أو اللي يكون dislisable toxin. الهيمولايسين طبعا مثل ما تكلمنا باعتبار الهيمولايسين اللي يعمل هيموليسيس للبلادكار، وبدليل أدنى نوعين من الهيموليسيس هم الألفا والبيتا اللي ينتجون الهيموليسين واللي يعملوا لي هيموليسيس، either complete hemolysis راح يكون البيتا أو البارشل هيموليسيس راح يكون الألفا. هذه الهيموتوكسينز أو ستريبتولايسين أيضا نفسه هو الستريبتولايسين أو اس طبعا هيموتوكسين O and S-streptolysin, which loses its activity after 30 minutes at temperature of 55 centigrade. This integrates erythrocytes, produce hemoglobinemia and hematuria in rabbits following intravenous injection. The second one is the leucocidine, which is this reactive to leukocytes, occur in highly virulent strain and is rendered harmless by temperature of 70 centigrade. The other one and third one is the lethal toxin, which produces necrosis in rabbits when injected intramicutaneously. It also causes necrosis in other tissue, particularly cells. The fourth, erythrogenic toxin, which produces inflammation in humans who have no antitoxins in their blood. Erythrogenic toxins. It causes lysis of erythrocytes and toxic for erythrocytes also. Streptococcus pneumonia produce alpha hemolysin, which is secreted into the culture fluid, and beta hemolysin, which is released after the lysis of streptococci. All of these are produced by streptococci. Also, we can take a look here on the antigenic structure of Streptococcus species. As you show here, we have extracellular substances. We have streptolysin, nicotinine adenine dinucleotidase, hyaluronidase, as well as staph, streptokinase, streptodomaces, and pyrogenic exotoxins. All of these are the toxins and enzymes produced from the Streptococcus species. In addition to that, we have capsule hyaluronic acid كبسول. هذا نوع من الكبسول أيضا يكون حقيقة ما نعتبره ترو كبسول، نعتبره هيلورونيك أسيد كبسول. مثل ما نعرف أنه الكبسولز for all microorganisms consists of polysaccharide، أوكي؟ لكن باستثناء طبعا الباسيلس انتراسيس اللي consists of amino acid اللي هو التريبتوفان. تمام. في حين الكبسول هو consists of hyaluronic acid، وهذه نعتبرها حقيقة أيضا not true كبسول أيضا، فهو لأن يكون non antigenic. تمام. cell membrane also butyroglycan cell wall group. طبعا البutyroglycan مثل ما نعرف بالcell wall in the gambas بيكون thick layer about 80 nanometer. جروب كربوهيدرات انتيجين رامينوز ان اسيتيلوكوكاسامين. الجروب الكربوهيدرات اللي هو على اساسه نعمل اللانسفيد كلاسيفيكيشن. والبيلاي الموجود البيلاي ان بروتين تايب انتيجين ريبوتيكويك اسيد ار انتي بروتين which is responsible for adhesion or attachment or adherence, and this do as adhesin molecules which is responsible for adhesion. Okay, regarding to the antigenic structure of this bacteria, the antigenic structure of Streptococci is based on serological examination. Griffith used the agglutination test, while R طبعا هذا الF Griffith used the E agglutination test, while R Lansfield employed the precipitin reaction with an extract of broth culture precipitate. 4 types of antigenic fractions were recovered from Streptococci. The type specific M protein anti-substance, a group specific polysaccharide اللي C substances, والnucleoprotein ال P substances. The M substances is a protein which confers type specificity, virulence and immunogenicity. The T substance contain O, K and L antigen. إذا صار عندنا M وصار عندنا ال T، بعد عندنا C وال P. Okay. The C substance is a polysaccharide common to the whole group of hemolytic streptococci. The P substances belong to the nucleoprotein fraction, being not specific for hemolytic streptococci. It contains nucleoprotein common to other group of streptococci as well as the staphylococci. Group A partly, group C and G streptococci possesses extracellular antigens اللي هو streptolysine O, a protein which causes erythrocyte hemolysis, and streptolysine S, which is lipoprotein complex possessing erythrocytic activity. وبالنسبة للstreptolysine O, it is very, very important in children suffering from tonsillitis. When the mom take the his or her child to the doctor to question the doctor about the what is the cause for tonsillitis. The doctor may advise this patient to do anti-streptolysine O titer in the laboratory. Why? Because streptolysine O is always associated with the Streptococcus biogenic infection. Tonsillitis may be caused by Streptococcus biogenes which produce O, streptolysine O. Thus, the baby will suffering from the difficulties in the movement, especially in the pain in the joint. Thus, because the toxin which secrete from the Streptococcus biogenes and the tonsillitis, it will be disseminated to reach to the joint to cause pain. And this area, thus the movement of the children is so if the child is very, very, very difficult at this situation, and thus if the anti-streptolysine is more than 1 to 800, the doctor may advise the patient to do tonsillectomy, for example, and according to this, the clinician may take a decision according to the not to the just and to the anti-streptolysine O titer, but to the clinical picture and other clinical investigations. Regarding to the classification of streptococci, by means of the precipitation reaction founded in the detection of a group with specific carbohydrate, streptococci are subdivided into groups which are designated by capital letters from A to H and from K to T. 5 out of 21 known streptococcal species cannot be related to any antigenic group. 9 species are of interest for medical microbiology. The hemolytic streptococci اللي هي تكون from sick يعني from sick human beings were subdivided by Griffith into 51 serovar. He attributed 47 serovar to group A and serovar 7, 20 and 21 to group C and serovar 16 to group G. All of these are recovered from the sick human being which were subdivided by Griffith. Okay. Pathogenesis and disease in human. Also, as we talked in the previous lecture in the staphylococcal disease, the pathogenesis of streptococcal infection is brought about by the effect of the exotoxin and the bacterial cells. The activity of the infected body and previous substance play an important role in the origin of development of streptococcal disease. Many diseases can cause also, like endocarditis, polyarthritis, hemorrhagitis, chronic tonsillitis, and erysipelas are associated with abnormal body reactivity. With hyperergia, this condition may persist for a long period of time and serve as the main factor for the development of chronic streptococcal disease. On the human being, on the different type of different body parts, we also can show the meningitis in the brain caused by streptococcus, otitis media or external otitis media or otitis externa, ear infection, sinusitis, an inflammation of the sinus, tonsillitis and pharyngitis. Here, as you show, as we talk, the infection by streptococcus biogenes, adenitis, pneumonia, infection of the lung, endocarditis, inflammation of the myocardium, impetigo, RSIB cells, scarlet fever, also in the skin, while pustular fever, myositis, fasciitis. Here, all of these are caused by streptococcus species. In addition to that, there are very important two streptococcal sequelae اللي هي الأكيوت glomerulonephritis والrheumatic fever. These are two streptococcal infections, streptococcal disease, caused by non-suppurative Streptococcus biogenes. Both of them are autoimmune disease caused as a sequelae for Streptococcus. With an exogenous mode of infection, Streptococci invade the human body from without, from sick people and animals, various contaminated objects and foodstuffs. They gain access successfully through injured skin as well as staph from the abrasion of the skin and mucous membrane or enter the intestine with the food. In the intestine with the food, Streptococci are mainly spread by the air droplet route. إذن هو يكون المود of action ممكن يكون من oral cavity infection when the neutral body resistance is weakened. Conditionally, pathogenic Streptococci normally present in human body become now pathogenic. What? Due to what? Due to natural body resistance will be weak, will be weakened, will be weak, and thus the Streptococci will be opportunity and can cause infection. It can penetrate deeply into the tissue and produce local biogenic inflammation, such as streptoderma, abscesses, phlegmonas, lymphadenitis, lymphangitis, cystitis, pyelitis, cholecystitis, and peritonitis, erysipelas, اللي هو inflammation of the superficial lymphatic vessels, and tonsillitis, inflammation of the pharyngeal and tonsillar mucosa, are among the disease caused by Streptococci. All of the signs important disease are caused by the Staphylococcus. Okay. Invading the blood, Staphylococci produce a serious septic condition. When invade the blood, when be invasive bacteria and introduced to the blood, it can cause septic condition. There are three very important terms in this situation. Bacteremia means the presence of bacteria in the blood. Septicemia means the presence of toxin in the blood. Toxemia, presence of toxin, the same. Okay. Septic shock. This situation will followed by bacteremia, septicemia, septic shock, and death. Right. These are the typical picture of tonsillitis, as you show here. This is the difficulty for opening his mouth, and this is the skin disease caused by species, as you show here. These are the skin infections caused by Staphylococci. Staphylococci may cause secondary infection also in patients with diphtheria, smallpox, whooping cough, measles, and other diseases. Okay? In this situation, Staphylococci may become secondary pathogen. Chronic tonsillitis is attributed to the virulent Staphylococci and adenoviruses. Contamination of the wounds with Staphylococci during war results in wound separations, abscess formation, leishmaniasis, and traumatic sepsis. Now we will talk on the very, very important two post-staphylococcal sequelae اللي هي السكارلت فيفر اللي هي طبعا الروماتيك فيفر والاكيوت glomerulonephritis. These post-staphylococcal sequelae will be taken in consideration solely. Scarlet fever here. Scarlet fever has not been known as a widespread disease, but at the present time, its etiology has not yet been ascertained. Four different theories here: streptococcal, allergic, viral, and combined. يعني السكارلت فيفر عادة معروف انه فقط تكون الكوز ايجس مالتها طبعا حمى القرمزية. عادة يعني تشخص بانه الكوز ايجس مالتها تكون ستريبتوكوكس بايوجينز. هنا احنا عندنا فور ثيوريز، 4 نظريات، واحدة منهم تقول الستريبتوكوكال هي الكوزز اوف سكارلت فيفر. الكوز الالرجيك ممكن يكون الالرجيك سكارلت فيفر، ممكن يكون فيرال سكارلت فيفر، وممكن تكون both of them viral and streptococcal scarlet fever. Most scientists and medical practitioners favor the streptococcal theory. إذن هو الstreptococcal theory, first theory, is the most common in medical situation. It is assumed that scarlet fever is caused by group A beta hemolytic streptococci, which possess M antigen and produce erythrogenic exotoxin. People become infected by the air droplet route. Sick K people, convalescent, and carriers of the cause agents of scarlet fever are all sources of infection. عادة الديسيز الage for disease يكون من 1 to 8 years of age. Okay? The causative agents sometimes enter the body through wounds on the skin and mucous membrane of the genitalia. This form of scarlet fever is known as extrabuccal or extrapharyngeal, اللي هي تكون traumatic, combustion, surgical, peripheral, and certain objects like utensils, toys, books, and etc., as well as foodstuff. Milk contaminated by adult carriers may also be a source of infection. Of great importance in epidemiology of scarlet fever are the patients with a typical, recognizable form of the disease in its initial stage. Scarlet fever is chiefly characterized by intoxication, while in the second stage it is accompanied by septic and allergic conditions. This is very, very important. Scarlet fever, as you show in this baby, This sad baby from the Scarlet Fever. According to the immunity of streptococcal infection, immunity already acquired after streptococcal infections is of a low grade and short duration. Relapses of erysipelas, frequent tonsillitis, dermatitis, periostitis, and osteomyelitis, all of them occurs as a result of sensitization of the body. هذا علم النعزي. What is the reason for sensitization for this situation? That's very important. That is attributed to the low immunogenic activity and high allergen content of the streptococci, as well as to the presence of numerous types of the organism against which non-cross immunity is produced. Immunity following streptococcal infection is of anti-infection nature. It is associated with the antitoxic and antibacterial factor. The antitoxin neutralizes the streptococcal toxin, and together with the opsonine facilitates rheumatic fever. When we tend to take regarding the majority of authors maintain the rheumatic fever developed as a result of the body becoming infected by group A beta-hemolytic streptococci, either acute or chronic. Tonsillitis and pharyngitis produce a change in immunological activity of the body. إذا هنا بنتكلم للبوست streptococcal sequelae rheumatic fever and acute glomerulonephritis. لازم يعني نعلم في شيء مهم جدا إن أنا من يصير عندي infection by group A beta hemolytic اللي هي streptococcus pyogenes, acute or chronic tonsillitis may occur here. واللي يصير عندنا يا طلاب يصير عندنا immunological mimicry أي تشابه. فشلون يصير هنا يصير change بالimmunological activity of the body give rise to characteristic clinical symptoms and a pathological reaction. هل allergic reaction اللي produced in the body as a result of reinvasion by antigen اللي هو streptococcal exo and endoxam autoantigen and complexes consisting of streptococcal toxins and component of tissue and the blood protein of sick people, all of them is an important factor in the pathogenesis of the disease. It is known that blood of individuals who have suffered from streptococcal infection contain antibodies against beta-hemolytic streptococci. Thus, this antigen-antibody reaction causes this autoimmune disease, rheumatic fever. Theory period, 3 حقب زمنية can be distinguished. First, period of acute streptococcal infection and initial sensitization. الحقبة الأولى من يكون في الطور الحاد وعندنا بداية السنسيتايزيشن. الحقبة الثانية hypergenic reaction resulting from interaction between antigens and antibodies. This is some spelling error, okay, which are accompanied by rheumatic polyarthritis or carditis. The third period of stable allergic activity accompanied by pronounced manifestation of parallergy and autosensitization, profound and stable immunogenic disruptions and relapses. These are the 3 periods of scarlet fever. And the laboratory diagnosis of scarlet fever is made on the basis of determination of an increase in anti-streptolysin or anti-fibrinolysin and anti-hyaluronidase titers and detection of active protein. Okay. With regard to the laboratory diagnosis, the material is obtained from the pus of wounds, inflammatory exudates, tonsillar swab, blood, urine, and foodstuff. According to the disease, urine in case of urinary tract infection, blood in case of bacteremia, tonsillitis, exudate in wound infection, and etc. Procedures are the same as for Staphylococcus. Tests include microscopy of pus, smear, inoculation of test material into the blood agar, isolation of the pure culture, and its identification. Either blood is sewn on sugar approach if sepsis is suspected. Virulence is tested on rabbits by an intracutaneous injection, 2 to 400 million microbial cells, and toxicity is determined always by injecting them intracutaneously. Regarding to the last slide, regarding to the treatment of streptococcal infection, as well as staph also, and usually penicillin is used. For penicillin-resistant strains, and when penicillin is contraindicated, streptomycin and erythromycin are required. Vaccine therapy like oral vaccines and polyvalent vaccine and phage therapy may be used also as a recommended dosage in chronic conditions. And in some countries, this is caused by beta-hemolytic streptococci of group A, C, G, and H, and by alpha streptococci in case of endocarditis, especially subacute bacterial endocarditis, which is very, very important in Iraq, are treated with anti-infectious, anti-toxic, and antibacterial. Antitoxic and antibacterial streptococcal sera together with antibodies and sulfonamide, and you must concentrate on a rule in therapy when you treat the disease caused by toxigenic bacteria. I must give antitoxin for neutralization the toxin produced by bacteria and antibacteria against the bacteria itself. Okay, that is a rule in the treatment of toxigenic infection caused by toxigenic bacteria. And that is all in this lecture. Thank you very, very, very much for your listening and for patience and for your interesting. Hope to be very interesting in this lecture. And please do not hesitate to present me any inquiries or any explanation or any questions regarding this lecture. Hope for you all the success. Thank you very much. Thank you.